Well, welcome everyone to our online program on addiction and recovery from the Sunshine Coast Health Center up here in Powell River, BC. And we've been talking about interpretations of addiction from anthropology, which is a little different than what I suspect most of you are used to. Most people think, when we talk about addiction, we're either talking about brain chemistry or maybe some maladaptive coping skills, to use the acute term for psychology, or something along that lines. Anthropology is a different view. It actually puts the emphasis on society, on culture, on political movements, things like that, the sort of the environment, the context, and says it actually creates the addiction. And one of the things that the anthropologists have taught us is that different cultures, different societies interpret addiction differently. So in Dr. Anne Lowell, who's a researcher, talked about this person that she had studied by the name of Pavel. Now, Pavel is a Ukrainian, and he went through heroin treatment, he was a heroin addict, in the Ukraine. And he describes it basically as a sort of prison. It's sort of like a weird hybrid between medicine and prison. But at any rate, for example, although it's officially he gets sent to a hospital, what happens to him is he's forced to detox. They inject all sorts of drugs into him without asking or telling him what these drugs are. And all the while he's strapped down to a table. And he says in the Ukraine that if you're an addict, you are essentially considered a criminal. So all addicts equal criminals. Anyway, so Pavel goes through this treatment in Ukraine. Then he comes to France, to Marseille, and he relapses. Interestingly enough, he relapses not only on heroin, but on the drugs that we use to treat heroin addiction in modern medicine, like methadone and buprenorphine and things like that. Anyway, so now he's addicted and he needs treatment. So now in France, they do not consider addicts criminals. They consider them medical patients. So now he's getting this exposure of what it means to receive treatment in France, which is he's not a criminal. He's got a medical condition. And it's interesting because according to the researcher, Dr. Lovell, Pavel actually changes how he makes sense of himself. So in the Ukraine, he considers himself a criminal. And so he's being punished. In France, he considers himself just as a person suffering from a medical disability. And so he's just receiving medical treatment. And according to the researcher, this is part of his identity. It's part of how he thinks about himself, how he answers the question, who am I? And again, it's the influence of the environment on the individual and how they think of themselves and, what treatment consists of and what addiction is really all about. So anyway, it was an interesting case study of this fellow from the Ukraine. Anyway, that's it for this online program. We'll be back next time with our final edition on anthropological studies of addiction.